All right, everybody, episode 45, the Daily Knowledge Project. This is our last video for the week. In yesterday's video, we talked about the ramifications of ignoring pain for too long and understanding that your injury can, in fact, get a lot worse over time. Unfortunately, in my clinic, what happens a lot is by the time people are ready to come in and see a doctor, they've already been dealing with it for a long time, and usually it's so bad that they can't function. And a lot of times we lose that window of opportunity for conservative care to work, and I have to make a referral out to a surgeon. I hate having to do that, but in some situations it gets so bad. But a lot of times people end up starting at the orthopedic surgeon. They get scared and think that they have to have surgery right away. And the surgeons don't do a very good job of letting you know the full ramifications of getting surgery. There are a lot of things that can happen. First off, you might not even need that surgery, and that could not be the right thing for you. Secondly, you could get an infection when you're in there. Third, you could have a complication from there. And even worse, you could just die from the surgery and have a big complication from there. So I always tell people you need to follow the pathway to surgery. Surgery should always be your last option. It should never be your first option. Your first option should always be conservative care first. Try that the best you can. If you failed conservative care and nothing else works, then by all means have surgery, but also know there are major consequences to that. Too many people jump to surgery too quick and they end up having bigger problems down the road. I'd be amazed at how many people in my office have come in and say, you know what, I wish I never had that surgery. But unfortunately, more people get surgery every day that don't need it. So take the time, figure out what's really going on, and weigh all your options, because there are a lot of long-term effects and consequences with having surgery, and you want to make sure you know all those going in. So that's my video for today. We'll see you guys next week.